Psoriasis is a chronic, inflammatory, non-infectious disease which affects at about 3% of the population. It is immune-mediated disorder which is not predictable, and we are not able to treat it efficiently for the rest of the life in all patients. My preference for the patients is to treat as much as possible efficiently and not to make harm to the patients. It means I like to prescribe the methods which we can achieve the best efficacy in the shortest time. Each and every method which we are using for treating psoriasis has its advantages and also disadvantages. For local therapies, the main problem is compliance of the patient, because it could take time to apply drug, for example, for large areas of the body. On the other hand, when we use phototherapy and systemic drugs, it's also necessary to consider all contraindications and healthy status of the patient. When I decide which therapeutic method to choose in my patients, I always consider the involvement of the skin, the age of the patient, the condition of total healthy status of the patient, and of course also the compliance and the wish of concrete patient, because we need to listen to our patients to make the best advice to them. Unfortunately, the optimal therapy we still don't have, because we cannot treat the disease completely. On the other hand, the best is the drug which could treat the disease as much as quick as possible and without any systemic and local side effects. So in general, we can say that if we can treat locally, it's better than to treat with systemic drugs. But we are not able to use this approach in each and every patient, unfortunately. Natural products are not really drugs, but we had chance to try Soratinex Australian products in our patients with chronic type of psoriasis, and we were surprised of its high efficacy in more than 80% of patients. We have, of course, patients who don't like to treat their lesions with corticosteroids, and for them it could be the option.